Welcome viewers. Today we will discuss the how do the angiotensin converting enzyme inhibitors works and what are their side effects. Angiotensin converting enzyme inhibitors are basically used for the heart failure and the hypertension. Angiotensin converting enzyme inhibitors are the captopril, ramipril, enalapril, lisinopril, lisinopril and the quinapril. The main action of the angiotensin converting enzyme inhibitors is the vasodilation. The mechanism of action of the angiotensin converting enzyme inhibitor is that the angiotensinogen, which is the protein secreted by the liver, is converted into the angiotensin 1 through the enzyme renin. This renin through the enzyme renin, which is released by the kidney. Angiotensin 1 is then converted to angiotensin 2 by the enzyme angiotensin converting enzyme. The angiotensin 2 is basically a potent vasoconstrictor. Moreover, angiotensin converting enzymes also affect on the bradykinin and convert it into its inactive fragments. Angiotensin 2 as a vasoconstrictor has so many functions which will be fulfilled by acting on the angiotensin receptor 2 type 1 and the type 2. The detailed mechanism of action of the angiotensin converting enzyme inhibitors are these. First of all, we'll discuss what are the angiotensin converting enzymes act. The liver secretes the angiotensinogen, and the renin from the kidney convert the angiotensinogen into the angiotensin 1. Angiotensin 1 is then converted to angiotensin 2 by the enzyme angiotensin converting enzyme, and these angiotensin converting enzymes also affect on the bradykinin, which is a potent vasodilator, and convert it into inactive fragments. When the angiotensin converting enzyme inhibitors act, the level of angiotensin 2 is decreased. Moreover, the bradykinin is not been converted into its inactive fragments. When the bradykinin is not converted into its inactive fragments, it will release the nitric oxide and the prostaglandin 2 irritation to the lungs in the higher level and cause the cough. Moreover, if the level of the bradykinin is increased, then the preload and the afterload decreased. The further functions of the angiotensin converting enzyme inhibitors are that if the level of the angiotensin 2 is decreased, then output of sympathetic nervous system is decreased. As a result, preload and afterload decreased. When the angiotensin converting enzyme inhibitors decrease the level of angiotensin 2, the vasodilation of the smooth muscle increased. As a result, the preload and afterload decreased. When the angiotensin converting enzyme inhibitors decrease the angiotensin 2 level in the body, then the retention of water and the sodium is decreased. As a result, the preload and afterload decreased. When the preload and afterload is decreased, as a result, the cardiac output is increased and obviously the blood pressure is decreased. The ADRs of the angiotensin converting enzyme inhibitors are the dry cough, hypertension, hyperkalemia, birth defects. Thanks for watching.